Hi, my name's Ann Ritter. I did a full extensive history of my patient. I have washed my hands. My patient's name is Mary. She's a 50-year-old female. She's a way color oriented ×3. Skin color appears to be normal. She appears to have normal nutritional health. She sits with good posture without any physical deformities. Her gait is normal without any assistive devices. Her range of motion is within normal limits. She has no involuntary movements noted. Her facial expression appears to be pleasant. She has a normal affect. Her speech is clear. Her hearing is within normal limits. And her personal hygiene appears to be good. We did a vision test using the Snellen eye chart, and she's within normal limits. I'm going to go ahead and check her hands and her nails. I'm making sure that her nails are even and of good color. I'm also going to check her turgor. And Mary, I'm doing this, and if it would stay tented for more than 3 seconds, that would show me that you're a little bit dehydrated. So I'm going to palpate the skin, and I'm also going to inspect for any bruising, any moles that have an odd shape or an odd color. And your skin feels nice and moisture, feels dry, no diaphoresis noted. Also feeling for temperature, and your temperature appears to be good too. Now I did your vital signs, and your temperature was 97.2, your pulse was 70, your respiration's 20, and your blood pressure was 26/80, which is fine. Okay. I also checked your weight and your height, and your weight was 134, your height was 5 foot 4 inches, and I worked out your BMI to be 23, which is fine. It's normal within your weight. It's a normal weight. Your waist circumference is 29 inches, and that's perfect. You're really healthy. I'm going to check your scalp. I'm checking to feel for any lesions, any bumps, any abnormalities, and that feels good right now. I'm going to check your temporal artery. I'm going to check your temporal mandibular joint. Can you open and close your mouth for me? Good. I'm also feeling for any lymph nodes. I'm looking for any swelling, any heat or tenderness, and I don't feel any of that. I'm going to take a look at your eyes. Have you had any infections, or do you have allergies or anything like that?
No.
Okay, so I'm looking at your eyes. I'm looking at the color of the sclera. That's the white part of your eyes. And I'm looking for any odd color, like a yellowish color, anything like that that might indicate any kidney problems or liver problems. Mm-hmm. I'm also looking for any drainage in the conjunctivitis or anything like that. Looking for any drainage. I don't see any. You look good. Also going to check your sinuses for any inflammation or red, hot that would indicate any infection, which I don't. Your nose. Let me put some gloves on. I'm just going to check patency of your nose. Take a deep breath in. Take a deep breath in. Good. And you're getting enough air. Now at this point I would also get an ophthalmoscope, because I didn't do that yet. So I'm going to get an ophthalmoscope, which I don't have. But I would check your media and your retinal fundus, and I'd be checking for shape, for color, for margins, and also the cup disc ratio. Okay? And then I'm also going to check your ears. I'm checking for any lesions, any swelling, inspecting the skin around it. I'm also going to pull up to see if you're having any tenderness in your ear, which it doesn't appear you do. Let me just turn around and look behind your ear. Okay. I would get an otoscope, which I don't have, to look at the external canal to make sure there's no redness, swelling, any drainage. Also look at the tympanic membrane to make sure it doesn't look inflamed or anything like any yellow drainage coming from it that would indicate any infection in your ears. Okay, neck. Can you turn your head? And can you look down for me? Can you smile? I'm checking cranial nerve number 7. Good. I'm going to check your mouth. Just going to inspect for any dental caries. Also looking at the gums for any redness or swelling, looking at the mucous membranes to make sure they look moist. Also looking at your lips to make sure they don't look dry and cracked that would indicate dehydration. Now, according to your history, you had your tonsils removed. Is that correct? Mm-hmm. Okay, so there is no tonsils back there. Can you go off for me? Okay, checking cranial nerve number 4 and 5. Okay, I'm just going to palpate in the side of your cheek. I'm feeling for any lumps, bumps, any ulcers or anything like that. Are you having any problems or pain in your mouth right now?
No.
Okay. I think that's it for now. Okay, now I'm going to assess the respiratory system. Normally I would do all of my assessments skin to skin, but Mary refused to take her shirt off, so we're just going to, for the sake of this video, forego that. Also, whenever I'm listening or auscultating, it would always be stethoscope to skin, but for the sake of this video, we're not going to do it that way. So Mary, I'm going to start out with a tactile firmness, and what I need you to do is say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. And I'm going to percuss now. Okay. So I'm listening for resonance, Mary. If there was any dullness sounding, it may mean that your lung fields had some fluid in it, or maybe a collapsed lung or something like that. So right now, everything sounds good so far. I'm hearing good resonance. It will be duller over visceral organs like your liver, things like that will sound dull because of that. Now I'm going to take a listen. If you feel dizzy or anything, we can take a break. So you let me know how you're feeling. I want you to take a deep breath in through your mouth, please. Are you okay? Okay, your lung fields sound nice and clear, but if we would hear any wheezing, inspiratory or expiratory wheezing, it may indicate some asthma. Any rhonchi or crackles could indicate emphysema or other lung diseases. So I will do the same thing anteriorly, but for this video I'm just going to do it posteriorly, and all the things that I did posteriorly would be done anteriorly. Although when you're doing tactile firmness on a woman, you want to avoid the breast tissue area because you will get it'll be inaccurate. So that's it for the respiratory. Okay, Mary, when I was checking your respirations and you're checking your back, I did notice that your respiration rate was 20, and that's fine. If it were higher than 24, it would be called tachypnea. Okay, so you're good. So while I've got you turned around, I'm going to just listen for any heart murmurs. So if you could just lean forward a little bit for me. Okay, I don't hear any right now. I'm also going to check your epitrochlear nodes, and they don't feel inflamed to me at all, which is a good thing. Now this part of the video I will just talk through, because the next part is a breast exam. I would have Mary lay down. I would drape only half. I would just expose the breast that I was going to examine at the time, and you can either go in a circular motion, or you can go up and down, or you can go from the nipple out. All right, but you want to make sure that you feel all the breast tissue for any abnormal lumps or bumps that don't move. You also want to compress the nipple to make sure that there's no drainage coming out. If there would be any drainage, like black drainage, you may want to put it on a slide and send it to the lab, because that's indicative of cancer. Breastfeeding moms may have clear or white or even blood a little bit if they're newly nursing their babies. You also want to make sure that you check under the armpit, because the tail of the breast extends into the armpit, and you want to check for axillary nodes as well to make sure nothing feels swollen or hot to the touch. You also want to inspect the skin at the same time for any lesions, any bruising, any moles that look like they need to be looked at, that are funny in color or funny in shape. And also, now is a good time to do teaching that soft breast exams are very important for you to do every month. Nobody knows your body better than you, so it's good that if you can feel it, to go to the doctor, because early detection is the key for breast cancer. It's very easy to check with soapy fingers in the shower. You can feel things easier that way. Okay, I think we'll move on to the cardiac system. Okay, Mary, I'm going to check your carotid artery before I have you lay down. Anyone who is middle-aged or has a history of high blood pressure, I should listen for a bruit, which I don't hear, and that's good. Okay, I'm going to have you lay down. At this point, I would inspect the anterior chest for any, do a skin inspection, feel for temperature, look for any discolorations, any bruising, any moles or anything like that that would need to be looked at.
Okay.
I'm going to inspect for an apical impulse, Mary, but it may not be able to be seen. So I'm going to palpate an apical impulse between the 4th and 5th intercostal space, which I feel. And I'm also going to check for a thrill, which is like a little vibration, which I don't feel. Okay? I'm going to take a listen to your apical rate with the diaphragm. Your heart's regular and your rate is 70, which I got when I checked your radial pulse. If there would be a big difference from what I got earlier in your apical, then I would want to get a pulse deficit. I would listen to your apical rate and check your radial pulse, and if there were a real difference, the difference would be the pulse deficit. I'm going to go ahead and take a listen to your heart. I'm going to listen with the bell. I'm going to have you turn on your left side, Mary. I'm going to listen to your apical rate again with you on your left. Okay. Okay, I'm going to inspect the abdomen. I'm going to inspect the skin. I'm going to feel for temperature. I'm going to look for bruising. I'm going to look for any abnormal moles or lesions or anything like that. I'm going to check the contour of the belly, and Mary's belly is flat. I'm also looking for symmetry to see if one side's out more than the other, and it's not. I'm going to check for an umbilical pulse, which I do not feel, but if I did, I would want to get an aortic pulsation that would be indicative of an abdominal aortic aneurysm, which I don't see for Mary. Okay, I'm going to auscultate and listen. I'm going to start in the right upper quadrant, because that's where you're going to hear the most bowel sounds within 5 to 15 seconds. And I'm going to work my way around to all 4 quadrants, which I do hear bowel sounds on Mary. But if you didn't, you would want to listen for a full minute on each quadrant to make sure that you have bowel sounds. It could either be hyperactive or hypoactive or absent, and sometimes if you have surgeries, the medicines they use for anesthesia will slow the bowels so you don't hear anything at all. So that's why we're listening for that. And then I'm going to percuss. And I'm going to hear tympany because there's a lot of air in your belly. Now if I didn't, it would be indicative of maybe a mass, or if I was over an organ, it would be a more dull sound. But right now I hear tympany for you. I'm going to percuss the height of the liver, which is going to have a more dull sound, and the spleen as well, which is more dull than we heard on the belly. I'm going to do light palpation about 1 centimeter deep, and I'm going to look for facial grimacing or any guarding. And then I'm going to do a deeper, which is about 1 to 2 inches. No pain or tenderness?
No.
Okay. I'm going to palpate for the liver. I feel it. And then I'm going to palpate for the spleen. And I'm going to palpate for the kidneys back here. Okay. I'm going to go ahead and inspect for femoral arteries and for inguinal nodes to see if I feel any swelling or inflammation. I'm also going to feel for temperature for hot spots, and I don't feel any on you. Okay, Mary, I'm going to inspect your lower extremities, and the first thing I'm going to do is just look for symmetry. If one leg's bigger than the other, which I don't see, I'm going to look at your skin for any bruising, any lesions or anything like that. I'm going to feel for moisture, if there's any edema, and for temperature, if there's any hot spots. Now, it's not unusual to have cooler feet and hands than the rest of your body. That's quite normal, but I'm also looking for any cyanosis in the toes or in your feet, and I don't see any of that. I'm going to check your pulses. I'm going to check your popliteals, which are behind your knee. I'm going to check your post-tibial, and I'm going to check your dorsalis pedis. Now, if you were to have any kind of knee surgery or anything like that, they may not be able to feel a pedal pulse, but you would want to get a Doppler, and it's just a little bit of jelly, and like they rub it on there, and they'll be able to hear a pulse, and then that nurse could mark it for the next nurse, so it's easier for her to find. But you have good pulses in that. I'm going to inspect in between the toes, looking for any ulcers or lesions, or any like fungal infection or anything like that, which I don't see. Also, Mary, you're quite active, but if I had somebody maybe who wasn't as active as you, I would want to look for pressure points on the heels to make sure that there's no bogginess on the heels or open areas. And of course on you there's not. Can I have you sit up and dangle your legs, please? Okay, now Mary, just from you sitting up, I could tell that your strength is not a problem for you. You have good range of motion, and you have enough strength. You're good. Okay.
You're good.
Mary, I'm going to check your neurologic system. I need you to push against my hand, and I need you to shrug up against the weight of my hands, and I was just testing cranial nerve number 12. Now I want you to close your eyes, and I want you to tell me when you feel, just say now when you feel something on your face.
Now. Now. Now.
Okay? Keep your eyes closed and tell me if you feel sharp or soft.
Sharp. Soft. Sharp. Sharp.
Okay. Keep your eyes closed.
Sharp. Soft. Sharp. Soft. Sharp. Sharp.
Okay. I want you to open your eyes, Mary, and I want you to use your thumb and your fingers and touch each finger as fast as you can for a couple of minutes. Okay, good. Now I'm going to put something in your hand. I want you to close your eyes. I want you to tell me what I'm putting in your hand.
Okay.
Okay? And then leave your hand open, close your eyes, and tell me what number I'm tracing on your hand.
4.
Okay, very good. I'm going to check for deep tendon reflexes, okay? I don't have a reflex hammer, so for the video I'm going to use my stethoscope. Okay. There, you just rest your arm on my hand. Rest your hand on my arm. Okay, I'm going to hold your thumb. Okay. So I'm going to talk to you about male genitourinary system. You would inspect and palpate the penis for you would look for signs of infection or STDs or any yeast infections, any edema, if it's hot to the touch, any signs of infection. You would compress the tip of the penis to see if there's any discharge. You would then assess the scrotum. You're looking for any lumps or bumps or any lesions, any blisters. Make sure they're both distended or both descended. You would ask them if they have any history of urinary infections, any kidney infections, any kidney stones. You would ask them about their urinary stream, if it's a strong stream, if they have any hesitance, if they often go at night, nocturia. And you would also check for hernias, inguinal hernias. I think that's it for male. Okay, I'm going to talk to you now about female genitourinary system. It's important to get a good history of their menstrual cycle. If they're sexually active, if they're with a partner currently, you want to talk to them about that. You want to ask them if they have a history of STDs and urinary infections, any kidney infections, any kidney stones. Women are a little more at risk for urinary symptoms because their urethra is much shorter than a male's. So you want to educate them about wiping from front to back to wipe the bacteria away from the urethra, not into the urethra. So you'll first start your examination by inspecting with gloved hands, as well as when you inspect the man's penis, you're going to use gloved hands. But you're going to inspect the external genitalia for any signs of infection, any lumps. You're going to look at symmetry of the labia. You're going to pull the labia majora back to visualize the clitoris and make sure that that looks like not swollen or inflamed or any infection is there. You will do an internal exam with a speculum and some KY jelly, and you want to visualize the vaginal wall and the canal and the cervix and the os. You want to make sure that the cervix is free of infection, not inflamed, not red, no drainage coming out of the os. You also want to obtain a pap smear while you're doing your examination by getting some cells and putting them on the slide, and then getting an endocervical brush inside the os and rotating it to get some endocervical cells. You also want to talk to them about if they're happy with their contraception or not. You want to it's a good time for teaching about all the options out there for contraception. You want to talk to them about safe sex, to limit diseases and STDs, always wearing a condom. They need to understand that oral contraception doesn't decrease STDs, it just prevents pregnancy. So it's a good time for a lot of teaching with people. Also, you're going to ask them if they have any burning or pain when they urinate, pressure when they urinate, and just go over good hygiene to prevent urinary infections. Also, you want to let them know that if they are taking antibiotics while they're on oral contraceptions, they will have to use another form of contraception during that time, like a condom, because the antibiotic leaves the birth control pill ineffective. I think that's it.